presentation, we have AlejandroDoradoGarcia. Unfortunately, he was not able to join us in person, so he sent us a video presentation instead. Let us watch the video. Dr. Garcia is a veterinary epidemiologist, and he studied at Complementa University. In 2018, he has been serving as an animal health officer at FAO. Let us now watch the video from Dr. Garcia.
My name is Alejandro Dorado. I'm a veterinary epidemiologist working as coordinator for AMR surveillance activities at global level from the FAO headquarters in Rome. My responsibilities include the development and implementation of digital services for enhancing capacities of countries for AMR surveillance. And today I will be talking about the International FAO Antimicrobial Resistance Monitoring System, INFARM, as a practical approach for the implementation of the Codex guidelines on integrated monitoring and surveillance of foodborne AMR. Pathogens in food and the food production environment have become increasingly resistant to antimicrobials, resulting in infections that can be difficult or impossible to treat. To address this concern, Codex texts provide a risk-based management option to help countries develop and implement effective strategies and policies to minimize and contain AMR-related risks along the food chain. Codex has developed 3 core texts on foodborne AMR to provide a framework for addressing AMR along the food chain, and has conveniently compiled these 3 texts in a compendium that includes the code of practice to minimize and contain AMR, the guidelines for risk analysis of foodborne AMR, and the guidelines for integrated monitoring and surveillance of foodborne AMR. There are also specific standards that can also help minimize and contain AMR indirectly and support the implementation of Codex texts. Today, we are going to be focusing on how to practically implement the guidelines on integrated monitoring and surveillance of foodborne AMR. The main aim of these guidelines is to assist governments in the establishment of integrated monitoring and surveillance programs. And they outline key components and considerations to offer different flexible options for monitoring and surveillance with a specific focus on foodborne AMR along the food chain, but also in the food production environment. They focus on foodborne pathogens of public health relevance, such as Salmonella and Campylobacter, and indicator bacteria, such as E. coli and Enterococcus. And they also focus on, on how to design, how to coordinate, and how to approach this in a systematic manner for antimicrobial resistance and use data collection from various sources, and to help also to compare data, to facilitate data analysis and the multisectoral data integration across the different sectors. As we know, there is a need for integrated surveillance of antimicrobial resistance. We need to have a One Health approach. We need to generate evidence across the different sectors to have interventions that comprehensively address antimicrobial resistance. So for this, FAO is working closely with the quadripartite organizations, with the World Health Organization, the World Organization for Animal Health, but also with the United Nations Programme for the Environment, UNEP. And we are working on a number of integrated surveillance initiatives. And one of the most important is the Global Integrated System for Surveillance of AMR and AMU, the GISA system. The GISA system is not yet launched, but is planned to be launched next year. And through the GISA system, what we are going to have is a repository of information coming from the different agencies on the data that is under the remit. In the case of WHO, they collect on an annual basis, and since 2015, data on antimicrobial resistance and antimicrobial use in humans through the GLASS system. In the case of the World Organization for Animal Health, they collect antimicrobial use in terrestrial and aquatic animals at the national level, and they've been also doing this for a number of years, since 2015. And in the case of FAO, we have just started this year with the collection of antimicrobial resistance in animals and food, and we will expand in the future with the collection of antimicrobial use in plant production and protection under the INFARM system. So the information coming from these 3 different systems, GLASS, Animuse, and INFARM, will be shared on an annual basis on the GISA platform to start forming a global system for integrated surveillance. As you can see also here in this slide, we are trying to synergize between the agencies. There is no overlap in the different data streams, in the different data collection mandates that we have coordinated between the different agencies. With the purpose to fulfill FAO's mandate and also to cover the gap for global integrated surveillance and to support the global efforts with the quadripartite agencies, we have developed the INFAM system. The objectives of INFAM can be summarized here. And INFAM is a global information system consisting of an IT platform and related FAO activities that assist countries in collecting, collating, analyzing, visualizing, and effectively utilizing their AMR monitoring and surveillance data, primarily coming from livestock, fisheries, and aquaculture, along their associated food products. The INFAM system is essentially designed to host and present AMR data through phenotypic antimicrobial susceptibility testing, and is focusing on priority bacterial species of public health significance, including zoonotic bacteria and foodborne pathogens, and commensal indicator bacteria from animals and food sources. And also is focusing on bacterial pathogens causing impacts in animal health and productivity. This is completely aligned with the guidelines on integrated monitoring and surveillance of foodborne AMR, but it's also aligned with the WOHA standards, the codes and manuals for doing surveillance in animals. This is the visual identity of the INFAM system. As you can see in the left side, you have with the shapes with bacilli and cocci, you have the data generation on the laboratories. In the middle side, you have the surveillance and the transformation of data on antimicrobial resistance in information that can be disseminated at different levels of aggregation that is depicted on the right side. As you can see, this is covering the whole cycle from data generation to data analysis and data dissemination. In the INFAM system, we can talk about very simply about the architecture. On the data generation side, we are accepting data from systematic monitoring and surveillance systems, but we are also accepting pilot monitoring and surveillance activities. And this is because we understand that there are different levels of development and implementation of national surveillance programs. From the inception, INFAM also accepts officially validated data from other sources, but these are the main two sources, and the data is classified accordingly as systematic or pilot activities at national or local level. Then we are also going to be collecting in the platform data that is contextualizing the information that we receive on antimicrobial resistance, such as assessment reports from assessment tools that we use in FAO, like the Atlas tool, but there might be also surveillance plans, surveillance protocols, and different other materials that countries might be sharing in a repository of information for contextualizing the information. The core objective, in the end, is to support countries in the collection, analysis, visualization, and interpretation of the data. And for these, countries have access to a restricted private interface with interactive dashboards for visualization of their data. And also, to support the global efforts on an annual basis, we will be migrating the data from countries that accept to publish their data. We will migrate this to the global interface, to a global public interface, to provide AMR prevalence and trends at the global level. The end goal of the INFAM system is to assist countries in the development and strengthening of operational national surveillance systems that can efficiently contribute to generate reliable and timely AMR evidence in animals and food at national, regional, and global levels. Specific objectives to achieve this overarching goal are to generate high-quality AMR data, also to enhance the capacities to meet global harmonized standards from WOHA, but also from Codex Alimentarius, also provide an analysis and dissemination of the information to different stakeholders on AMR prevalence and trends. We also want, through the INFAM platform, to detect the emergence of new antimicrobial resistance traits, and of course, all this also to inform targets for the design and implementation and monitoring of the effectiveness of evidence-based interventions against AMR in agri-food systems. Through all this information, we will also be able to estimate the extent burden of antimicrobial resistance in animals and food sectors. And of course, in the end of the day, what we want is to facilitate the integration of AMR surveillance information into risk analysis, decision-making, and monitoring and evaluation processes to use all the data and utilize all this data and information that we are generating through the surveillance systems. In 2024, we have worked in the publication of several guidance materials. We have updated the website, and we have also published the manual for implementation of the INFAM system. We have also opened the first annual call for members for all countries to participate in the INFAM system through the submission of antimicrobial resistance data and also through the submission of a surveillance questionnaire that gathers and contextualizes the level of implementation of surveillance activities at the country level. So a communication was sent from FAO through official channels to the FAO representatives and also to the FAO liaison offices to contact the national authorities, the key personnel responsible for AMR surveillance across the food chain. These are responsible officers at the national level for antimicrobial resistance surveillance in livestock, fisheries and aquaculture, and also their associated food products. Through this official call, we have received nomination of INFAM focal points from countries that have already started to submit antimicrobial resistance data and information. And after the close of the call, that we expect to close the open call in October 31st, we expect to consolidate all the data, consolidate all the information, and see the feasibility for producing a global report on antimicrobial resistance, a baseline global report of antimicrobial resistance at the global level. In this request that we have sent to national authorities to nominate INFAM focal points, of course, we have also highlighted the manual, highlighted all the requirements to participate, but here I would like to summarize the 3 key requirements for countries to participate. And the first requirement is for national authorities to sit down and identify the AMR surveillance components that they might already have in their country. When we talk about AMR surveillance component, we talk mainly about peripheral laboratories that are responsible for producing a volume of isolates for surveillance, for national surveillance. We are also talking about national reference laboratories responsible for supporting the peripheral laboratory network on antimicrobial susceptibility testing, standards, quality, etc. But we are also talking about a national coordinating center or a national coordinating structure that is responsible for programming activities at the national level on surveillance, that is responsible for also for the analysis and dissemination of AMR results. So what we are asking countries is to identify these components and to answer to a questionnaire that is online, is inside the INFAM IT platform, and this questionnaire on different components of the surveillance system is focusing on specific surveillance programs, and we are going to talk about the different surveillance programs later, but also on the integration of these different programs as a whole at the national level. The second requirement, of course, is to identify the national INFAM focal points and start reporting the status of AMR surveillance in agri-food systems through the surveillance questionnaire, but also to start reporting antimicrobial resistance data for the different surveillance programs according to the INFAM technical specifications. And the third requirement is to countries to commit to gradually establish national AMR surveillance in agri-food systems. And for this requirement, we also have tools in FAO that support countries in the progressive advancements of the capacities of the countries to strengthen the national surveillance systems. For this, we have the assessment tool for laboratories and AMR surveillance systems, the Atlas tool, for which we are also working on the digitalization and to connect this information from the assessments that can also be used as a proxy for the quality of the data that we are receiving in the INFAM system. The INFAM system and its IT platform operate under a framework to accommodate the varying levels of development and implementation of activities across countries, and also to gather antimicrobial resistance data from a comprehensive range of microorganisms and associated specimens covering all the surveillance programs in animals and food. The INFAM framework is aiming at supporting and harmonizing the process of obtaining information at the national level and also collating AMR data in animals and food in specific and individual AMR data files. AMR data submitted to the INFAM should be collated and gathered in different AMR data files based on the reporting cycles. Here, all isolates from samples collected within the same year should be in the same AMR data file. Then we also ask countries to tell us the statistical representativeness and also the scale at which surveillance activities are implemented. All AMR data files should be characterized to indicate if the isolates are coming from pilot activities, representative or not, of the national situation, or from systematic and routine surveillance programs that are representative of the national situation. Then finally, isolates should also be classified in different data files according to the surveillance program they represent. And for this, we have defined 5 surveillance programs. The first 2 surveillance programs are the diseased and aquatic terrestrial animals, and these are having primarily an animal health purpose to inform clinical decisions and antimicrobial resistance, antimicrobial stewardship. In this case, what we are talking about is isolates of bacterial pathogens in animals that are coming through passive surveillance of specimens received from diagnostic laboratories. The other 3 surveillance programs are also in here, which are healthy terrestrial and aquatic animals, and also food at processing or point of sale. These surveillance programs are also having a primarily focus on public health. What we are talking about here is about active surveillance, collecting mainly fecal samples in animals and meat samples from carcasses or from food products to understand the transmission of foodborne antimicrobial resistance pathogens, mainly Salmonella and Campylobacter, and commensal bacteria, Escherichia coli and Enterococcus, across the food chain. In this way, what we do is to ask countries to compile different antimicrobial resistance surveillance files according to the reporting cycle, the scale of activities, and also according to the surveillance programs. And these individual AMR data files are going to be sent to the INFAM data platform for digesting the information and generating automatic data visualizations. As part of the Open Call for Data in 2024, we have also been trying to expand the team of support from FAO in the regional decentralized offices, but also we've been creating communities of infant focal points at the regional level. So we started, of course, the work from the global perspective, from the FAO team in headquarters. Here we have the global team, also the IT developers and all the team in the agroinformatics and digitalization division in FAO headquarters. And what we did is 3 regional training sessions. The first one was conducted in Latin America. Then we had a session in Sub-Saharan Africa and also in Asia and the Pacific. In total, 167 participants from 46 countries were participating. And in these participants, mainly we had the national infant focal points, but also we had the FAO personnel, that are the people who are also in the pictures in the map, and colleagues also from the FAO reference centers on AMR. So through this way, what we have done is to expand and to create community for regional and global support for the generation of these INFAM data files and for the submission of information into the IT platform for this first open call in 2024. During the INFAM regional trainings, we had the scope of going through the whole journey of the data. So as we know, the different critical stages of antimicrobial resistance surveillance start with the planning of activities, planning of the surveillance plan, and putting all the elements together on how to do the sampling. So then we go for sampling at the different sites, surveillance sites. We collect the samples, then we submit the samples to the laboratory for isolation, characterization of the bacteria. Then this information needs to go into laboratory information management systems, into data management systems that allow to submit this data to the national authorities for further analysis, interpretation, but also for dissemination of this data and this information to the different stakeholders. And the INFAM trainings were focusing mainly on these last 4 elements, on the submission, on the data management of antimicrobial resistant data on antimicrobial susceptibility testing results from the laboratory through data management systems. In this case, we were having practical sessions on HUNET and also how to do manual data management and preparation of INFAM data files. Then we were also working on the submission of these INFAM data files into the IT platform. Then we were looking together at the different visualizations, relative absolute frequencies, histograms and trends that are produced through the Infam IT platform. And then in the last day, we were having a session on how to use this information, how to use all these different prevalence and trends that are coming out from the Infam data platform for disseminating the results to the different stakeholders and also to inform decisions for policy and for interventions. So I would also like to give some notes on what is the way forward after this year of opening the call for data and also for this year of training to Infam focal points. So during the years 2022 and 2023, what we were doing is to develop and validate the IT solution. So we created the beta version, we had a pilot, and then what we did is also to build interoperability with data management systems and to develop the manual for implementation. And this took us to 2024. This is the year in which we are doing the early implementation of Infam. In this year, what we have been focusing all the efforts is on having this first annual open call for data, on the publication also of guidance materials, the manual for implementation of Infam. We've been also doing trainings in data management as part of the regional trainings. And we are also working on additional IT resources. We are also working on interoperability of Infam with other tools. In the year 2025, so in the year 2025, if there is a possibility to have a global report, if it's feasible, if countries are participating at the public level and countries want to share this data at the global level, we will publish the first global report with baseline data on antimicrobial resistance. Otherwise, we will need to wait a little bit more for a second open call. In this year 2025, we of course plan to have a second annual open call for data. The data on antimicrobial resistance will be produced on an annual basis, as for the other platforms with the quadripartite, as for GLASS and also for Animius. And through this annual open call for data, we will also work on the integration of the data into the GISA platform, into the Global Integrated System for Antimicrobial Use and Antimicrobial Resistance. Of course, we will integrate this data with GISA, but we will integrate with other data platforms also inside FAO. In FAO, we have also the Hand in Hand initiative. We have the agroinformatics platform that also has information on transboundary animal diseases, also on other health aspects and other aspects on data that would be very useful to connect with the data coming from the Infam system. In 2026, we will consolidate all the lessons learned over the last years. We will also continue with the annual open calls and reporting of the information, but we will consolidate all this knowledge. Also, maybe we need to do a global consultation with the stakeholders to understand and to see what is the future of the platform beyond the early implementation. And we also want to include additional surveillance activities and additional surveillance data that is also under the remit of FAO. We would like to put more attention also on antimicrobial use in plants and crops. And of course, we would also like to work on the collation and the collection of data coming from whole genome sequencing, from next generation sequencing techniques into the Infam IT platform, because we understand this is also the future, and this is also the trend that is also at the global level. A lot of antimicrobial resistance data is already being generated through these new techniques. And with the way forward, I would like to finish thanking our donors, the Ministry of Food and Drug Safety on the Republic of Korea, also the Fleming Fund from the United Kingdom. And we would like to thank you for all the support that we've been receiving through these projects. And I wish you a very good meeting and a very good conference on Foodborne AMR. Thank you very much.